Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Smears. KOH smear. 10% potassium hydroxide smear is used in fungal infection. Potassium hydroxide dissolves keratin and not fungal hyphae. Skin has an active margin which is kept for 10 to 15 minutes. Here in the in KOH solution, skin is kept for 10 to 15 minutes, whereas hair and nail have more disulfide bonds. They have hard keratin. Because hair and nails have hard keratin, we should dip it in KOH solution for overnight. Hair should be obtained by plucking the hair along with its root, whereas nail, mainly the proximal part of nail, is obtained through nail clipping. Dermatophytes on KOH smear are seen as branched septate hyphae. Candidal infection on potassium hydroxide smear are seen as budding yeast cells with pseudohyphae. Pityriasis versicolor on staining with potassium hydroxide smear, we see spaghetti and meatball appearance. Spaghetti is hyphae and mycelium, and meatball represents yeast cells. Malassezia is actually a dimorphic fungi, so it has both hyphae and yeast forms. Tinea capitis. Tinea capitis has ectothrix and endothrix. Both these can be seen on potassium hydroxide smears. Endothrix have the spores inside the in the endothrix the fungal spores are present inside, whereas in ectothrix the fungal hyphae are present outside the hair.
thank you and thank you for watching.